Hello everyone. Today we are going to discuss about gynecological investigation. So let's start. So first there are some common investigation in gynecology. So I have listed out total 11 investigation that is commonly done for gynecological patient. First one is blood values, urine examination, urethral and vaginal and cervical discharge, exfoliative cytology, colposcopy, imaging techniques, endometrial sampling, biopsy, callosynthesis, endoscopy and hormonal assay. There are total 11 tests. These are the tests that is normally used for the gynecological patient. Now we are going to see in one by one in the blood test what are the things they are going to do. So in the blood test, first they are going to do hemoglobin estimation test, total and different count, ESR, platelet count, bleeding time, clotting time, and they are going to do the serological test or BDRL test for Australia antigen or HIV. Next one is urine analysis or urine examination. In that they are going to do urine routine or microscopy or urine culture and sensitivity test or urine pregnancy test. As we are discussing about the gynecological condition, so third point is going to add here, urine pregnancy test. So in the urine routine we are going to see the normal appearance of urine, that is physical examination, chemical estimation of protein and sugar, pus cell and cast. And the second, cultural and drug sensitivity, we are going to see that which is the bacteria that causes this condition. So that we are going to find out through culture and sensitivity test. And the third one, in urine pregnancy test, we are going to diagnose that the person is pregnant or not. So this is about urine analysis or urine examination. Next one is, that is urethral discharge. So from the urethra they are going to collect the urethral discharge and they are going to send for test. So urethral discharge is collected on a cotton swab for the test purpose, for the diagnostic purpose. Next one is vaginal discharge. So method for the collection, patient not to have vaginal douche for 24 hours and cuscus valve speculum introduced and discharge from the posterior fornix on the blade of speculum or cervical canal taken with swab, and microscopic examination, discharge mixed with the normal saline, and that it can be sent for the culture and sensitivity test also. You can see the picture here that showing how they can collect the vaginal discharge for the test. Next one is exfoliative cytology PAPANICOLAOU test. So it is a PEP test screening test for the cancer, mainly for cervical cancer. Okay, it is first described by PAPANICOLAOU and Tront in 1943. It is a routine gynecological examination in the female, especially above 35 years. So yearly screening for 3 years followed by 5 yearly tests. So if the person don't have any signs and symptoms of the cervical discharge and all, they can go every 5 years as a precautionary measures. So and if the person have shown some symptoms, and every year they should go for the test. In the short form we will say PEP test. And uses, that is screening for cancer and identification of local viral infection like herpes and condyloma aquaminata or cytohormonal study. So these are the things we can identify through the PEP test. So you can see the what are the articles needed to collect the swab from the cervical cancer. Okay, let's see, this is the procedure. How pap smear screening of cancer is done. You can see in this procedure the speculum is used, and with the help of spatula they are collecting the swab from the cervix and they are doing the test to diagnose the things what I have discussed in the previous slide. Next one is callosynthesis. So it is a transvaginal aspiration of peritoneal fluid from the pouch of Douglas, And diagnostic procedure is done in case of pelvic abscess, ectopic pregnancy, or to detect malignancy, means cancers. So these are the things to find out that we are going to do this chaldosynthesis. So instruments used in chaldosynthesis is valsalum or vaginal speculum or aspirated syringe. So these are the instruments needed to aspirate the fluid from the vagina. Now you can see in this picture how with the help of that syringe and the speculum and the valsalum, they are collecting transvaginal fluid for the diagnostic purpose. Okay, next one is colposcopy. So colposcopy is a gynecological procedure that illuminates and magnifies the vulva, vaginal wall and the uterine cervix in order to detect and examine abnormalities of these structures. So with the help of colposcope, this instruments is called as colposcope. With the help of these instruments, they are going to visualize these are the parts. So that's why this name is came colposcopy. Our next investigation is hormonal assay. Hormonal assay means to know the condition of metabolic process of hormone or to know that any imbalance in the hormone process. So in that they are going to see RIA, that is radio immunoassay, or ELISA, that is the mean full form is enzyme linked immune sorbent assay, or they are going to see FSH, that is follicle stimulating hormone, LH luteinizing hormone, prolactin hormone, or ACTH, that is adenocorticotrophin hormone. So all the hormones, if there is any type of imbalance, that they are going to find out through that hormonal assay. So it will be easy for diagnosis the menopause or any type of PCOD, that is polycystic ovarian syndrome. So this is the need of doing hormonal assay to find out any type of PCOD is present or any other disease that is related to hormonal imbalance. Our next investigation is imaging techniques, that is as you can see in the picture, the first one is X-ray. You can see that is done for normal patient also, and ultrasonography, that also ultrasonography. There are two types of ultrasonography. One we can, that is non-invasive, another one is that is transabdominal ultrasonography, another one is transvaginal ultrasonography. So ultrasonography also non-invasive procedure and X-ray also non-invasive procedure. This all are the procedure, it is coming under the imaging techniques. This is the picture of transvaginal sonography, or in the short form you can call as TBS. Next one is computed tomography, that is in the short form CT scan, to find out any type of tumor and what is the size of that tumor and how much it is spread, that we can identify through CT scan. Next one is magnetic resonance imaging, in the short we can call it is MRI, and one more is positron emission tomography, PET. So these are the two tests that is also comes under imaging techniques. So with this we have seen there are 5 types of imaging techniques that can be used to find out any disease in the gynecological patient. First one we have seen X-ray, second one we have seen ultrasonography, in that we have seen 2 types, one is transabdominal, one is transvaginal. We have seen CT scan, we have seen MRI, and we have seen PET. Next one is endometrial biopsy. So the endometrial biopsy is a medical procedure that involves taking a tissue sample of the lining of the uterus. The tissue subsequently undergoes histologic evaluation, which aids the physician in forming the diagnosis. So it will help the physician to find out the diagnosis, mainly for the cancer this biopsy has done. So the tissue is taken from the endometrium, so we will call it is a endometrial biopsy. Next one is cervical biopsy, same thing, that tissue is removed from the cervix to find out is there any cancer tissue or not. So that's why we will call it is a cervical biopsy. Our next investigation is endoscopy in gynecology. So in the gynecology also we have some type of endoscopy. In that first we have seen there are 4 types. One is laparoscopy, one is hysteroscopy, one is colposcopy, one is salpingoscopy. So what is the meaning of scopy is visualization. So now we are going to see one by one what is laparoscopy, what is hysteroscopy, what is colposcopy, and what is salpingoscopy. So about colposcopy, already we have studied that with the help of colposcope, if you are seeing the parts of the vagina, that is called as colposcopy. So if you are going to see or if you are going to visualize the fallopian tube, it is called as salpingoscopy, and if you are going to visualize the whole uterus, this is called as hysteroscopy. And if you are going to observe the abdominal part inside the uterine part, that is called as laparoscopy. You can see in this picture how they are doing the laparoscopy with the help of small. It is a technique which allow a viewing or diagnostic and surgical maneuvers therapeutic to be performed in abdominal organs through a surgical incision, that is less than 1 centimeter, with the help of pneumoperitoneum. So these are the endoscopic procedure which is done in gynecological cases. So with this we have finished all the investigation that is carried out the patient with gynecological disorder to find out the diagnosis. So with this we have finished this gynecological investigation. Thank you everyone.